I'm Paul Russell. I'm the Medical Director for Children's Medical Services in the Department of Public Health. There are two programs in Children's Medical Services, one known as CHDP, which is a well-child screening program for low-income families, and the other one is known as California Children's Services, or CCS, which provides services for children with chronic disease. Both those programs exist for only one reason, and that's to assure that these children receive the highest quality of care. And that's why I'm here to talk to you about the County Organized Health System proposal before you and why I support it here in Ventura County. I have not always been the medical director here in CMFS, although it seems like that for many people. There was a period of time where I was a medical director for Blue Cross of California's Medi-Cal Managed Care program here in the state of California. That program at that time was the largest Medi-Cal Managed Care program in California. It operated as the commercial plan in the two-plan model in 6 different counties. It was the local initiative in 2 counties. It partnered with several of the county organized health systems. It was an eye-opener for me working with a commercial plan that had shares of its stock sold on the New York Stock Exchange, and to see some of the pressures that are brought to bear at certain times of the year that affected decisions regarding programs. And that had unintended consequences. The State Department of Health and their Medi-Cal Managed Care Services has a method that they evaluate the quality of care in their Medi-Cal Managed Care programs, and it uses some indicators that are developed by the National Commission for Quality Assurance, or NCQA, and they use these measures that are healthcare effectiveness data information sets, or HEDIS indicators. And in 2008, they looked at 23 of these indicators. And some of them are very important to me. They pertain to care of children. How often did a plan get their children into well-child visits for under 15 months of age? How often did they get them for 3, 4, and 5 years of age? How often were they immunized? They also looked at prenatal care and postpartum care. They looked at 6 different indicators regarding the care provided for people with the chronic disease of diabetes. They looked at asthma. They looked at the appropriate antibiotic use in children. 17 of these 23 indicators were compared looking at the county organized health systems, compared to the commercial plans, compared to the local initiative. 17 of the 23, the county organized health systems had the highest quality of care. Now, the commercial plan did rank number 1 in one item. They actually have an indicator looking at poor care in diabetes management, and the commercial plans actually had the dubious distinction of being number 1 in that. They also looked
the dubious distinction of poor care?
Poor care in diabetes management. Meaning that
not doing it well?
Not doing it well.
Not care for poor people, but doing poor care.
So if you look in their 2008 report, and where they list number 1, and the commercial plan is number 1, if that one indicator is the one indicator, it's not good to be number 1 in. So actually the lowest plan organizer, plan model, was the county organized health system. So from a quality of care perspective, the county organized health system is clearly superior. The geographic managed care with multiple insurance plans that have no accountability to Ventura County is clearly the worst plan. So I encourage you to pass this ordinance and bring a county organized system to Ventura County. The children and the disabled and Medi-Cal will really appreciate that.
And thank you very much for 3 minutes.
Okay.
Thank you, Paul.